So, Joe, what do you think about this free screening thing that Dr. Cavestein's doing?
I think it's wonderful. A year ago, I came to the free screening, and the only reason I did was because I felt, kind of bad that the doctor was giving up his time to be here, and I wanted to make sure that I'm one more person going, and everything was normal at when I came to the screening, except for my family history. And after discussing it with the doctor, and the fact that coronary artery disease runs in my family, back to my great-grandfather, my brothers, my grandfather. So he said to come in for a stress test, and it was as a result of the stress test that they discovered I had a blockage, and I had some stents put in, and it turned out that the blockage was 85%. That main artery, coronary artery, was blocked 85%. I didn't have a clue. I had no palpitations, no shortness of breath, no chest pains, nothing. And the only thing that really, the reason I'm still sitting here is because it started with this, and then Dr. Cavestein, he wouldn't let go of it. The insurance company didn't want to send me for a test. He just kept hammering away because he said, I have to find out what's going on inside there, and thank God he did. And so I'm glad to see we have a decent turnout today of our teachers and staff because the price is right. You're coming in, you're meeting with a specialist, you're getting some initial testing done, but more importantly, he's talking to you about your history. And that's really what triggered it for me. Today, two of my sons came here, not because they have any heart issues at this point, but there's a history. And they want to get a baseline, make sure things are okay for them. So I think it's fantastic. I think Dr. Cavestein, he's always going to be a hero in my life. He saved my life. So anything I could ever do to help him or have other people go to him, you're putting yourself in outstanding hands if you go see him.
Otherwise, we might have been interviewing a new superintendent of schools at council.
I got to tell you, all it takes is a tiny bit of that plaque breaking off and clogging up that little 15%, and you have 5 minutes to get to the hospital. That's the artery they call the widowmaker, because you have no time. Once it clogs all the way, game over.
And would you recommend screenings to other people?
Absolutely. I think it just makes sense today because it's non-invasive. You don't have to give a lot of time to it. And even the stress test that you go later on, he does a very thorough Doppler on all of your arteries and veins to see that they're clear. It's very thorough. Then you can leave at least knowing, I'm a 1951 car. Chances are something could be wearing out at this point. So I have to go see somebody who understands it, and he's the guy.
And at the last screening, we had people as young as their 20s coming in and getting screened because early detection is the first thing.
And that's the thing, it's not, age is not, my brothers had heart attacks in their 30s, and they were both in good shape and all the rest of it. So genes and genetics play a big role in that, and you can't fight that. But what you can do, as they say, is detect it early enough, and they did just early enough in me, that I didn't have the heart attack first, and then you're dealing with damage to the heart besides, the issues that brought you there in the first place. So this was great, and then he also sent me for cardiotherapy afterwards, and it was wonderful, and I feel a whole lot better than I felt. But I can go to put my head on the pillow at night, not worried about it.
Yeah. Joe, I want to thank you for your time.
My pleasure, Larry.
Good words.
Good seeing you.